This is Danny Bobrow, President of AIM Dental Marketing, welcoming you to this installment of the Practice Perfection Web-Based Education Series. Tonight's presentation is entitled, Transform the Way You Heal Your Patients, and is being delivered by my good friend and fellow founding member of the American Academy for Oral Systemic Health, Lisa Marie Samaha, DDS, FAGD. Lisa Marie has extensive training in the field of integrative medicine, with an emphasis on advanced medical and genetic testing and nutritional physiology to deliver true preventive medicine and healing to her patients. You will soon learn why she is noted for her enthusiastic and inspiring presentations to medical and dental audiences worldwide. During the Q&A session, Lisa Marie has also, at the cajoling of yours truly, I owe you one, Lisa Marie, has agreed to extend a most attractive offer for Practice Perfection attendees only, a way to experience Lisa Marie up close and personal, a short 7 weeks from today. You'll definitely want to stick around for that. For nearly 4 decades, Dr. Samaha has based her practice on the principles of total body wellness through complete health dentistry. Her pioneering practice focuses on the advanced, non-surgical treatment of periodontal disease and all aspects of the oral systemic link. Observing a significant disconnect between the scientific research and its application in the clinical setting, in 2007, Dr. Samaha founded the Perio Arts Institute. She presents evidence-based clinical protocols for the diagnosis and non-surgical treatment of periodontal disease. Her multifaceted approach empowers general dentists, periodontists, and their teams to seamlessly transform themselves into true wellness-oriented practitioners of dental medicine. She is a 1982 graduate of the Medical College of Virginia, Virginia Commonwealth University. Practice Perfection webcasts run for around 90 minutes. While attendees are in listen-only mode, we do invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to get your questions answered. If we are unable to get to your question today, we'll see that it's answered shortly thereafter. Because this presentation is being recorded, and you will receive a link to it, I ask that you not feel compelled to take copious notes, but of course that's your prerogative. Just sit back, relax, and enjoy Lisa Marie's presentation would be my recommendation. Your attendance today does entitle you to receive 1.5 hours of continuing education credit. Shortly following the webcast, you will be emailed a brief survey with instructions on how to receive your CE. Participants are cautioned about the dangers of incorporating techniques and procedures into their practices if the course has not provided them with adequate clinical experience to allow them to perform it competently. And now, it is my sincere pleasure to welcome to the Practice Perfection stage, Dr. Lisa Marie Samaha. Hello, Lisa Marie.
Hi, Danny. Gosh, that was pretty involved. Thank you for the nice introduction. I'm not sure where you pulled all that, but I appreciate it. And I know that the audience is ready to really get rolling. So I'm ready, and super excited to be here. As you know, this is truly my passion in life and has been for many, many years. So let's look at how I kind of define my mission and vision for where we are and in all of this. And I really, when I established the Institute, Perio Arts Institute, which had 2 sort of arms to it, the Perio Arts Research and Perio Passion Dental Seminars. So we've since closed the loop on the research, which was fascinating, on blood testing and DNA testing, and I'm more purely focused on the seminars these days. So anyhow, it's really, the mission is to transform the manner by which dental practices help people heal, and I've kind of felt a calling to that since I was very young, and I'm super happy to have been able to accomplish this vision of caring for each human being through the lens of total body wellness within my own practice. So it's certainly what we stand for at Port Warwick Dental Arts, which is my practice, and it is definitely what we love to teach and share. So anyhow, it's really a simple premise, and that is based on healing the mouth. By healing the mouth, we heal the body. Healing the body, we heal the mouth. Can't have one without the other, as you know. But anyhow, like many of you, I've had mentors in my life. And fortunately, like many of you, my dad was one, and certainly the most influential. And coincidentally, I always had this passion for it, and for the business of dentistry and the concept of total body integration, because as a little child I heard my dad speaking that language, and then years later I felt such a calling to teach, and to teach this connection and to base my practice on this connection, which I established at the age of 25 in a town I had never lived in. So it was a little bit of a rough road, but I actually felt, and I tell my doctors when I teach, that I truly feel like I was born into doing this, this was my mission, implanted in my soul before I was ever born. And in fact, years later, I realized that I literally was born into it, because in 1956, my dad completed his Perio residency under Irving Glickman, and he was his kind of right-hand grad student and did a lot of those case studies that we had in our big blue Perio book, but certainly didn't get the credit for it because he was the student. But anyhow, by the time I was 5 or 6, I knew this is what I wanted to do. And then here I am at the age of 12, putting together my little pegboard that some of you might remember. We didn't have film core back then, and my little hand drawings and a few photographs that my dad had given me. But, it was just something I was fascinated with, and my brother ended up being a physician, and I the future dentist. So right there with my little pointer, little wooden pointer. So it's been there in me for so long, and now 47 years later, here we are, and looking forward to moving through this now that you've got a little introduction to who I am, and understand where this comes from, certainly from my heart and soul. So anyhow, mirror for general health and well-being, the mouth. This is nothing new, certainly goes way back into the olden days of before dentistry was even a profession, that so many people thought this, and back in the 30s and 40s and so forth, we had kind of had some little shake-up within dentistry, and a lot of people thought dentists who believed this were quacks and so forth. And by the 1940s, so that focal infection theory kind of went away, and now, of course, we're getting this great resurgence with all the thousands of pieces of scientific literature that we have. So anyhow, just looking at these 4 items here, the overall health, medications, harmful habits, and nutritional status, that we as dental professionals have been directed to consider when we're looking into the mouth and the health of it. And this was from our Surgeon General. Certainly this is a physician who made this statement back in the year 2000. And then and then shortly thereafter, Dr. David Satcher took over as Surgeon General, and he made the statement that the mouth can become a source of disease or pathologic processes affecting other parts of the body. So, we really have well-founded research and the big guys telling us that this is what we need to do. When we look at the science and the statistics, we realize that about 80 to 85% of the American population have some form of periodontal disease. And I really want to make that distinction between periodontal disease, periodontitis, and gingivitis. When I say periodontal disease, I'm speaking of gingivitis and periodontitis. And a lot of people make a distinction there that I don't know where that came from, but I know when I was in dental school, it was very clear. Periodontal disease meant gingivitis all the way through periodontitis. So as I speak about periodontal disease, I'm speaking of it in general, encompassing everything from A to Z, everything from the first point of bleeding in the mouth or the first evidence of bacterial contamination as we find on a DNA samples, let's say, even if there is no clinical symptom. And we'll get into that a little bit more deeply. But, you know, when we think about it, look at this. 85% of the American population has something like this going on. You know, that's literally from, well, maybe that's from B to C, but we all see the A's, of course, occasionally, but not so often. And one of the things that I really want to focus with just a few quick before and afters. When we talk about total body wellness, we really literally are talking about total body wellness. We're talking about healing a patient from top to bottom, from inside out, and it shows so distinctly. This is just within a couple of weeks where we've gone and completely transformed the not only the facial features through the dentistry that was done, but if we look at the eyes and certainly the skin tone, and there may be a little bit of a difference in exposure here, but these are some older slides, but just a beautiful case, I think, because her eyes just come alive when her body starts to come alive. And it doesn't take long. This is Rich, who was 19 years old. And by the way, the previous patient was a school nurse. She was a grade school nurse for many years and then became a friend of mine and through church and came to see me. And I was so delighted that she allowed me to share her story, because I think, we all see patients who are in the healthcare professions who have situations like Marilyn did. And, it's so hopefully not within dentistry, within the dental profession from one end to the other. Hopefully we don't see anything like that, but certainly within the rest of medicine we do. And here we see Rich, who was 19 years old, and his employer sent him to me. And you see this face on the left-hand screen, and look at Rich's eyes, and this sort of what I call dead eyes, and the complexion. Look at the scaliness around his nose and all over his face. This is a sick individual, the darker circles under his eyes, but just in 2 weeks, by removing the disease factors, which included some extractions and so forth, we end up with Rich looking very vibrant, and so much so that, his whole personality changed. His voice dropped about 8 octaves, and he just became an incredibly robust individual almost overnight, so much so that he said to me when he came in for his week post-op, he said, I said, so how have you been doing? And he said, Dr. Lisa, you will not believe, actually it was his 24-hour post-op, and he had gone to Home Depot the night before. And he said to me, I was working on I said, how are you feeling today? And he said, great. I was working on a project at home, and I had to go to the Home Depot, and this was right after multiple almost a full mouth extraction case, and it was the first time a woman had hit on him. So this was in his whole life. So this was a screen name Weasel Boy, and no longer was he in that frame of mind, obviously, and physically certainly not. And this is Ellen, and we all have cases like these, but probably don't always look at the before and afters to really realize the great work that we do. And so I want to encourage you all and your staff. I mean, my clinical team put these together for me. I don't even have to think about it. I just say, let's put that case together, and they do it. So certainly any assistance on the call or hygienist could be part of this process, and then certainly get your permission from patients to utilize these. But this is Ellen, and Ellen just looking so sickly, and she had tremendous physical problems, and boy, did she really come alive just within a few weeks. So you see the sparkle in her eyes and so forth, and the complexion and all of that. So anyway, but what are the patient's perceptions when we talk about periodontal disease and periodontal treatment? A lot of them have had some familiarity with it, and they come in, and you're examining them, and you're getting bleeding, and no matter how much you preempt that the measuring or the probing, with, if your gums are healthy, there will be no tenderness, no bleeding, no pus. Everything should just feel fairly comfortable. Even when you say that to the patient, if your tissues are healthy. If they're diseased, it will probably feel prickly or irritating. Please let me know if that's the case. And we don't have to continue today. We have some ways to help you get healthier before we provide the complete examination, because I don't want to hurt you. Well, anyway, so we do the measurements, and of course I'm bleeding. You're gouging me with that damn pick. The last girl ripped my gums open with that tool she was using in the periodontist, cut my gums open, and I was dying in pain for days afterwards. Now he wants to do the surgery all over again. Don't we hear these things? It's a pretty much a regular kind of conversation in my office. And so we do have some good, strong verbal skills to try and preempt all of that, and put the responsibility back into the patient's hands, so they know that it is not us. So we share a lot of that in the course, and anyhow. But let's kind of get on to what makes us different when we perform our treatment or our therapy. How is our experience different so that we can achieve painless, progressive, profitable perio and total body wellness within our practices? So I've listed here in the orange all the different steps of taking a patient through treatment, things that I kind of felt like were the important basics of the whole process. So of course we bring our patients in on consultation, and then allow them and us to determine whether it's a good fit. So and for the most part, because of our website being fairly robust and talking about what we stand for, and because of our reputation in the community and so forth, we get people who come in who are a very good fit from the very beginning. So we have established ourselves and our place in dentistry within our community very, very strongly for the past 34 years, and continue to do so with outreaches, programs and things that we do at our practice and out in the community. But anyhow, so going into the examination process, the things that I've highlighted in the fuchsia color are the areas that perhaps you may not be doing already, and I do understand that many of you are very well advanced in this area, and so but just to get us all on a level playing field, I'm going to touch on on most of these things as we go, so particularly from testing, the testing area, because testing and supplementation, because those are the things that we teach in the course that actually set us apart from most of the protocols that are being presented or the seminars that are being taught. And we actually started the protocol that I am going to review with you tonight in 2005 within my practice, and it was in 2007, the beginning of 2007, that I felt it was strong enough to be able to share with others. So familial history is certainly something we ask about, and we actually have that on our intake form, our medical history form. So it includes all three pieces, medical, dental, and familial. And then we always perform advanced oral cancer screening and explain to our patient why, and we have no problem talking about HPV issues and in the process of doing that. So then we get into testing, and the phase contrast microscopy, I'm going to say that is a standard part of our consultation with our patients, or at least by our new patient comprehensive exam. Then we move into DNA testing. I'm going to talk about two different forms of DNA testing, a brand new one hot off the press that I will be introducing you to with just a couple of slides, because that's all we have time for tonight. And then the blood testing and the 4 basic blood tests that I recommend and have been performing for years now, and find that there's no way that I can practice dentistry without blood work, without actually having blood tests and results in front of me when I am with my patient. So whether it be getting them from their physician if they recently had some testing done, but always supplementing that testing that they've had done with testing that I want because I'm treating an active infection of periodontal disease within their body. So a little bit different than what the physicians typically request. Oral systemics, we talk about that and we'll touch on it just briefly tonight. Lifestyle issues, particularly as it pertains to nutrition, and then getting into the whole issue of supplementation, because we are dealing with people who are sick. Their bodies are sick, not just their mouth, their teeth, their gums. Their bodies are sick. And when we are treating sick people, we want to provide them with a process that's going to help heal their body from the inside out. Not just do things to them, but help them support the healing process internally as we treat them externally and as they are taught the skills that they need to utilize in order to improve their hygiene and so forth. Home care aspects. So the administration of it, we do cover that within the context of the two-day seminar, but we talk about fees, how to bill for fees, what are a general range of our fees, medical and dental insurance billing. We've gotten patients as much as $30,000 in medical benefits for their dental treatment, for their periodontal treatments specifically, and oral surgical needs. The treatment, and everybody probably utilizes piezo ultrasonics or some level of ultrasonic therapy. We also use laser and ozone therapy, and we talk about that within the context of the course. I will not be able to touch on some of these, but mostly get into the testing issues today. So let's move into a little bit about what gives us permission, and not only permission but direction, and that is to do all of the things that I'm going to talk about tonight, and that is through the American Academy of Periodontology's position paper in the year 2011. That's already 5 years ago, and all of the things we're talking about we have been directed to do. So there is precedent, and we need to pay attention to that. It's not getting any better. Hospitalizations for dental infections have increased more than 40% between the year 2000 and 2008. And by 2010, that increase had gone up another 10% to a total of 50% of hospitalizations for dental, an increase by 50% an increase up to 50% of hospitalizations for dental, of a 50% increase in hospitalizations for dental infections. Excuse me.
The number's just staggering you, isn't it?
Yes, they are. They are. And thank you. And what is so astonishing about this is these are not just emergency room visits. If we tallied up emergency room visits, it would skyrocket this number. These are hospitalizations. These are people who were being admitted into the ICU because they were going to die if they were not hospitalized. These are people who are immediately put on IV antibiotics. So I think that's a really important piece of information to share with our medical colleagues. So anyway, and we all have seen the Columbia University, the Cigna, the Aetna studies that talk about how early treatment of periodontal disease reduces medical costs for these very critical areas of health. This one done on 145,000 members. And then these are over 20 areas of health that are directly impacted by periodontal disease, and we're certainly not going to step through these right now, but some of these I will talk about as we move forward. And we all know the general risk factors for periodontal disease and the oral risk factors. And I just put these in as sort of place cards to say, yes, we are aware of these. I don't think we need to dwell on them. But one area that you may not, or we may not all be aware of, is that stress, distress, and depression are all independent risk factors for periodontal disease. So when we look at all of the 20 or so, or the many multiples of the periodontal oral risk factors for periodontal disease, and then we add on the general risk factors that we saw earlier than that, and then we go forward, general, oral, and behavioral. Then we look at this piece of research, that 3 risk factors. So take all of those together, and if we only have 3 of those, we're 27 more times likely to have periodontal disease. And if we have 4 of those risk factors, we are 64 times more likely. So with this in mind, is it no surprise that 85% of the population has periodontal disease? So I created these charts for patient education so that when we are talking about these issues and we're looking at blood work and we're looking at DNA test results, we're looking at their phase contrast microscopic slide, we are also talking about they're visually seeing all the areas of their body that this is related to. So we offer these and many of the slides that I have here as handouts for our attendees when they're actually in a CD or a thumb drive that they can print and utilize for patient education as well. And then this is a chart that I made a few years ago that I took all the research I could get my hands on from all over the world, and I compiled the data and created these statistics showing the risk factors, the percentage of risk of these particular disease states with periodontal disease. And the one that has the largest issue related to it, or the largest percentage, is the fatal heart attack if P. gingivalis is present. Well, I'm here to tell you that P. gingivalis is present in a real majority of our patients with periodontal disease when we test them through DNA testing. And a fatal heart attack increased by 1,350% if P. gingivalis is present, and that is based on research. So if you just glance at this, you can see this is really a very, very significant issue. So now just let's look at, why do we care about how, let's say our hygiene department is functional, it's moving forward and so forth, and but we're not really capturing that 85% of our own patient population. So we're going to just spend a few minutes running through some slides, and we can revisit these at another time, personally or certainly within the context of the seminar, because I know we want to get into the meat of the protocol. But I just want you to realize the potential within your practices. Even if you have a small practice that's like mine, 1,000 adults, that with 1,000, and we have more than that now, but let's just say 1,000, and we were at that level for very many years, and yet did a very robust production and collection activity. So we look at this, and if we calculate this, we're looking at, if 85% of our patients within our practice are supposed to be seen 4 times a year, as perio patients are supposed to be seen, we see that we've got 3,400 visits per year. Then we look at the other 15% that should be seen maybe twice a year, and that would be another 300 visits. So we've got 3,700 appointments per year. 48 weeks out of the year maybe is going to be, for most of us, 192 patient days, 19 patients a day, per day in hygiene services alone. Then let's look at what that value is monetarily. And if we look at all of these parameters and put an average figure on a periodontal maintenance visit and a regular preventive visit, whether or not x-rays are needed and so forth, we see that with 1,000 adults, we have the potential of almost $1 million in hygiene production alone. Then we add, that doesn't even include new patients. So let's say we have a modest influx of 10 new adult patients a month, which I would not imagine any of us have that low account. But if we do, this is another area where we can really tap in and bring people into our practices by marketing and establishing ourselves as a total body wellness practice. So here's another $308,000 in revenues. So let's say, okay, not all of our patients are going to be compliant. We're not going to get them all to do that. Even if 50% of them come in, we still have $650,000 per year in revenues. And if our hygiene revenues are a healthy 30% of total revenues, we have a $3 million practice. And I think that's staggering. I think that's incredible. We're talking about one doctor and 2 hygienists, a couple of assistants.
And we talked about this before too, Lisa Marie, that obviously, it's important that the practice be viable, and in order to continue to help people, that it needs to be compensated for the work. But we agree, and it was an argument that he kind of went with the presentation. This is sort of, we get this sort of out of the way. There is money to be made here. You can certainly do well by doing good, and that's really just the start of the benefit and really the joy from doing this. The real joy comes from the stories like you already shared with us.
Yeah, and I mean, absolutely. I'm the last person on earth who has money as my focus, and anybody who knows me knows that. It is something that I felt I wanted to share with everybody because I started to realize the potential is so far beyond what any of us would ever suspect, no matter what. And, many of you know of Rachel Wall, and she's got a beautiful hygiene program that she offers. And she made in one of her articles many years ago that 30 to 40% of our percentage of collections should be hygiene, and that shows that we're delivering a very high level, that we're capturing most of our perio patients and so forth. And other folks are suggesting that 50%, even 60% is good, and we have had many months of a 60% hygiene revenues within our practice. So I do want to say that that is very much possible. But, so let's go into some of the foundational issues of how we go about moving forward and touching upon these areas. We are going to kind of switch this order up a little bit, because I want to talk about what we all know, and that is that periodontal disease is an inflammatory disease. Certainly it's infectious, and it's a biofilm disease, so it's resistant to antibiotics unless we're actually treating the patient. We never put patients on antibiotics just based on their DNA results. We always begin with clinical protocol, clinical care. And then the day of clinical care begins, we begin the use of the systemic antibiotics. So that is based on some good science, and so we never bend on that. But remember that we're talking about something that's equivalent to a 9-inch open wound, and that is based on Offenbacher's description of it, and I really like that, and I oftentimes liken it to, with patients, I say, this is like, God forbid, you stepped out of my office and you tripped on your way out and you skinned your face against the concrete, and you got up and your face was just a bloody mess and you were in so much pain, and all you could think about was getting home. And when you got home, you were hurting so badly, and it stung, and it ached, and it was bleeding, and you couldn't even imagine scrubbing it clean and disinfecting it. And so you just let it fester, and it just sat there in it. And what would happen, I say to my patient, and they say, well, it would get infected. And I say, yes, it would get infected, and pus would ooze from that wound, and blood and pus would continue to ooze from that wound. And it would be an infection that would affect your whole body's health, correct? And they say, correct. Okay, so then I show them this picture, and I show them how the bacteria actually invades the gum tissue, and I describe what this picture means by using actually my fist and the cuff of my jacket, and I show how we're talking about the lining as the lining part of my cuff, and that's where this is. So it's much easier to show than it is to describe how we do that, but it's very, very effective. So anyhow, we've all seen the Secret Killer, this Time magazine for years has been something we've all used, and no wonder. So inflammation comes from 4 areas in the body, and oral inflammation is without a question the #1 source of inflammation throughout the body. We're talking about the endothelial system, blood vessels, 70,000 plus miles of vasculature. This is an incredible surface area, and we also think about how those the vessels are absolutely on fire. It's as though we took little tiny microscopic bottle brushes and inserted them within our blood vessels and scrubbed those blood vessels raw from the inside. And that is actually a word picture that I teach with. I teach my doctors and I teach my patients that especially if they're diabetic or have a cardiovascular situation, we talk about that. So anyhow, but look at the research. My gosh, 32% of traditional periodontal therapy fails within 9 months, and 64% fails over time. That's atrocious. Why does that happen? And I think for sure, not only do I think, I totally believe, and I'm here to say that our research definitely supports this, that nutritional lack is, in my opinion, the #1 issue going on. We have gum tissue that is permeable because there is no intact epithelial lining. The epithelium is fragile. It is porous. There is no barrier. There is no, the terrain is not structured. It's not substantial enough to prevent the invasion into the microvasculature through the gum tissue of this tremendously destructive bacteria that goes along with the condition of periodontal disease. So, this is my Middle Eastern family from back in the 50s, and you can see all this beautiful, healthy food on the table. And I was certainly raised with a Mediterranean diet, and so that was then, and this is now, and our family reunions are filled with wonderful, wonderful Middle Eastern food. All very healthy. Everything you see on this screen is something I would highly recommend as part of your everyday diet, and things that we talk to patients about as well. So anyhow, and that's just a little piece of lifestyle discussion that we have with our patients regarding things like exercise and so forth as well, but particularly talking about what we refer to as periodontal nutrition. And certainly we would not be able to achieve those robust results that you saw in the before and after photographs and in this patient's photograph without the support of nutritional supplements, and these are targeted pharmaceutical grade nutrients. They are the only kind I recommend. And let me just offer my disclaimer right here. I have no investment. I receive no money, have received no money from the companies that or any companies that I utilize or use. This presentation is as independent as they come. So should I mention a company, just know that that is very much a part of my protocol, independent of any receipt of monetary investment or receipt of funds.
I think it's also important to share, as you have, pictures of nice meals, because I think often when people hear about nutrition, they think starvation.
Yeah,
or,
we're going to see some pictures
brand.
of what I mean.
Yeah.
Yeah, we're going to see a few more.
Food can be delicious, and people actually find that as they start eating more healthy, as I have found this myself, our cravings and taste for the higher fat, higher sugar content foods really abates. That becomes more palatable.
Oh yeah, it almost becomes repulsive. Well, yes, exactly, Danny. So, why does our profession question or minimize the role of nutrition? I just think it's so basic that in 1982, when we didn't even have the internet, and when I was just a rookie 25-year-old dentist, I sat down and started looking at nutritional literature to figure out how to crack the code on periodontal disease. I was my dad's surgical assistant. He was a well-known, renowned periodontist back in the day, and he, spoke on the platforms with his colleagues. All of the people, our instruments, our surgical instruments are named after Kirkland and Orband and all of the famous guys. And you know, I was his surgical assistant by the time I was 15. I saw beauty. I saw beautiful hands doing beautiful sculptural, artistic surgery. And fortunately, he did not have the failure rates that I have seen from other practitioners within my own region. And I don't, and from elsewhere, I don't mean to incriminate anybody right here, but just you saw the statistics. And, we just, I just still felt like there had to be another way. And as I started to look into my own nutritional health and well-being and my preparation for becoming pregnant with my first child, I really wanted to make sure that I was doing everything right to support my pregnancy and that sort of thing. So that's how this all came to be, and my focus in this way. And I started to really get into the research at that time. So anyhow, the American Academy of Periodontology themselves say nutrient deficiency has a direct link to periodontal disease, further proving a systemic connection requiring nutraceutical support. Yet at every American Academy of Periodontology meeting, and these are internationally, they are huge international meetings that are exquisite with the science, but they do not support their own statement of this issue in their educational advancements. So I still, as a member of the AAP since my early years, my beginning of practice, I still am not seeing them stepping up to the plate in this arena. And back in 2004, this was published in one of our journals, and just talked about my belief of periodontal. I kind of guess I coined the term periodontal nutrition, and that specifically just means what the periodontal tissues need in order to remain healthy. And I just want to take a split second to mention that the periodontal tissues are the most delicate, fragile tissues in the entire human body, and they are internal tissue. They are the same kind of tissue that lines our internal organs, and yet they are exposed to all of this aggressive bacteria, some of the most aggressive bacteria that lives in the human body. And not only that, but the toxins and the pesticides and everything else that just attacks us. So we've got, the need to really address this and kind of move into, these are my patients. These are people that I see every day. I am known for treating people who are very sick, systemically debilitated, medically debilitated, dentally debilitated. I love this because I love surgery. And wouldn't you know, the person who loves surgery started doing 90% less surgical therapy, less periodontal surgery when in 2005 when I began implementing the protocol that I'm sharing with you tonight. So let's just show you what I mean when I talk about the transformation that can occur with just simply nutritional support in and of itself. First, I'm going to show you doctors who may not know this, but just to empathize with our hygienists out there in our audience. What I'm about to show you is what our hygienists see every single day with their new patients, and possibly even with their recare patients. And these are just down and dirty little intraoral camera pictures that, when they're blown up to the size of my 17-inch monitor here, they look quite pixelated, but I collected these many years ago when I was doing this little study for myself. And so these are what the pictures, we take these kind of pictures on our patients their first visit by just gently touching under their gum tissue with a scaler, but not scaling. I'm not doing anything but inserting the scaler under the gum tissue. I'm not going to cause them pain. I tell them there is no discomfort associated with this, but I would like their permission to actually experience what their tissues look like? Because that will tell me a lot about where we're heading as we move forward. And they always say yes. So I say, may I gently touch your tissue with my instrument? And when I do, I want you to look at what happens with me on this monitor that's in front of you. And if you don't want to see it, I understand it may not be a pretty picture, but I want to know, and I'm going to document it within your chart so that I know how best to prepare your treatment. So this is what your hygienists see. This is it. This is me. These are my patients, and I'm the hygienist in these photographs. And so I experienced this firsthand. And in 1998, I decided to the first nutraceutical specific for the treatment of periodontal disease, or for the use in treating periodontal disease, came out, and I started using it because prior to that I was using my own nutraceuticals that I could find. I'd send people to the health food store to pick out these different ones, and then all of a sudden I see that here's a product that has almost everything that I recommended in one capsule. So I said, wow, this is so easy. Let me start to track this with my own patients, and this is what I found. And again, I received no monetary compensation for doing this. This is day one, the picture on the left. Picture on the right is 7 to 10 days later with no treatment. In other words, the picture on the left is consultation or screening or new patient exam, where I've touched the tissue gently with my scaler, the blood comes pouring out, we snap the intraoral picture, the patient takes a look at it, the patient freaks out, says, oh my God, what is that? And we didn't even hurt them. Then we put them on the nutraceuticals. They come back 10 days later so that we can continue their therapy and not hurt them. And this is how we do it painlessly. Because what do we see here? We don't see perfect health. I'm going to show you. I'm just going to run through a bunch of these. But you can see on the pictures on the right, that tissue's not healthy. It's still unhealthy. But when I touch it with my scaler, this is what happens. It doesn't bleed, or a little speck of blood. This is it. That's not healthy. But we got shrinkage. We got decrease in inflammation immediately within that short period of time. So when we go in to scale and root plane, when we go in to treat these patients, we don't get the pain. In fact, my assistants can tell you that, my hygienist assistants can tell you that in a year's time, I may only anesthetize 1 or 2 patients at the very, very most for treating their periodontal disease non-surgically. So all of my scaling and root planing is done, for the most part, with no local anesthesia, and not even any of the, I'm trying to think of the name of it. I don't even use it anymore. The topical that came in the syringe, that high-powered topical. I know you hygienists know what I'm talking about, and I can't say, I want to say Quicks is at the end of it, but anyways, I don't use it, and our patients are so comfortable that we are able to use our ultrasonics and even hand scaling. So, and there's a process that I teach within the course about how we do that, and I don't ever want a hygienist to eliminate hand scaling. It is very, very critical in ascertaining how your patient's tissue truly is on PMTs and recare visits. So we know it's a silent disease, and in fact, here is our beautiful patient that I had finished her veneers some months ago, and she had remained so healthy and so beautiful. Tissues looked gorgeous every single time she came in, not a speck of bleeding, and then all of a sudden she comes in one day, and look at what we have on the view on the right. That's what happened when we started to examine and scale her. What's going on here? Well, it turned out that Christine, when I asked her, Christine, something's different here, what's wrong? Well, she's 50-some years old. She's not pregnant, but she had just suffered the sudden death of her mother, and it was extraordinarily emotional. In fact, it was the first time in her life she had ever experienced panic attacks. So even sitting in my chair, she was shaking, and it was all a part of this experience. So here's our next patient, and remember we said stress distress and depression, independent risk factors alone and of themselves, independent risk factors for periodontal disease. So here's Katie. Katie is of childbearing age. So here we see Katie's beautiful veneers that we had just put on a year or two before. She had always remained healthy. This is what they looked like clinically. I photographed her on the top, and then when we did scaling, this is what she looked like on the bottom and also on the top, but the lower picture was a better example. So anyhow, my children, I was invited to lecture at the American University of Beirut, and when we went, my children came with me, and I had to put my token picture of my beautiful children in there, of course. And I'm going to share with you a few photographs from that just to show you more of that Mediterranean diet in living color. But just think about color and how color is in our diet. And this is one of my slides from 2001 that I put together. So this is not a new concept to me, but it's been new in fact, I had been teaching my patients about this since the 80s, just on my own awareness and study of nutrition. But in 2001, I put together this slide based on research that I had put together. And so that just gives you an idea that we need all these colors. Think of an artist's palette. We need all the colors on our food plate at every meal, preferably. And so this is what is eaten over there, and this is what so here are nuts. We get our omega-3s, these beautiful olives. That's the kind of diet, and this is breakfast. My gosh, this is breakfast in the hotel. Where's where are the donuts and the continental breakfast? This is the breakfast, and this is
the chocolate-filled croissants.
Isn't this awesome? And this is my plate, and oh, it's the best. This is what I eat when I'm with my family. This is what we eat. So, for breakfast, throw some eggs with it, make it into an omelet, whatever. But, anyhow, so that's what we're talking about there. So nutritional status, we go back to what our Surgeon General directed us to consider back in the year 2000. And I just highlight that because I hope I've made the case for it in those slides and that part of the presentation. So I spend the majority of the time talking about that in this presentation. And looking here at this slide that I also created for my doctors at the course, and they can share this with their patients, or they can use it as a reference guide when their patients come in with a red beefy tongue or with burning mouth or angular chelosis. Any of these issues, oral issues, lysine needs to be added to this list here, because lysine, when it comes to oral herpetic lesions and oral ulcers, is also something that we want to consider definitely supplementing with our patients with, and perhaps keeping them on it every day of their lives if they have a propensity to herpetic outbreaks or aphthous ulcers. So anyhow, the Cleveland Clinic says that only 9% of people fit into their definition of healthy lifestyle, and healthy diet is certainly part of what they look at.
That's remarkable, because a BMI of 30 isn't even particularly good.
Yeah, yes. So we look at anti-inflammatory solutions, and Danny did want me to spend more of my time on this, but I know that our time is getting away from us, so I'm going to go through pretty rapidly this part and just hit on some nutrients that we really want to be looking at, and sometimes we even test for. We have special testing that we do that looks at the average level of nutritional status of our patients, testing 36 different nutrients, and for their levels over the past 1 to 2 months, not just their levels today. And that's what you're going to get from a traditional blood test. But through the testing that we do, we are able, if we elect to do it for a patient, if they're not getting well based on our standard protocol, we then look at what else could be going on from a nutritional perspective that has not been supported enough. So we certainly know about the anti-inflammatories like fish oil and so forth, but Let's look at vitamin D3, actually is a pre-hormone and something that is really, really critical to periodontal health and bone health. And we do know that it is incredibly, and these are the Perio references to it. Magnesium is also very important in K2. All of these things are critical for the support of healthy bone. And not to mention many other things in the body. And we all know that the issue of vitamin C with the scurvy, with the sailors back in the 18th century coming from Europe to the United States. And this is, in fact, a present-day issue of vitamin C deficiency that we determined in one of our patients through testing. And I should tell you that I had an internist many years ago who came to me, and she actually was diagnosed with scurvy. She's an internal medicine specialist and diagnosed with scurvy. So it's still a present-day illness. And with smokers need twice as much vitamin C support than others to support those soft tissues. So, and then the bottom line being with relating to tobacco use is that 50% of the risk in periodontal disease is attributed to smoking, and we do know that it is the #1 source of periodontal disease, or the #1 causative agent or risk factor. Vitamin B2, angular chelosis. I remember learning that in dental school. That was the one thing about nutrition that I did learn. And then vitamin B6 and B12. Proteins are important for wound healing. And of course, we're dealing with a wound. We're dealing with a 9-inch wound, or a wound equivalent to the side of our face, or the forearm, the dorsal surface of the forearm. Curcumin is the new kid on the block for treating periodontal inflammation and inflammation anywhere in the body. So turmeric or curcumin, we want to look at things like that. And there are actually wonderful holistic organic toothpaste that our patients can create for themselves. I have several different toothpaste do-it-yourself toothpaste that are all organic and use essential oils and things, and use turmeric powder and so forth in them. Also cacao, wonderful for adding to a toothpaste and getting that chocolate flavor of toothpaste. And I think I just posted something about that on, I shared a post on Facebook yesterday. So feel free to go to my Facebook page, Fort Worth Dental Arts, or Lisa Marie Samaha, my personal page. I think it's on both. But anyhow, so don't forget what the American Academy of Periodontology already knows, but doesn't really seem to embrace yet. So gut health, immune function. So we talk about gut health in the process of evaluation of our patients as well, and I always ask my patients, tell me about your gut. How does your belly feel when you eat or after you eat? Do you have loose stools? Do you suffer from constipation? I have no trouble, nor do any of my team members, talking to patients about these issues, because if the gut isn't healthy, where 70 to 80% of our immune function occurs, then we're never going to get those periodontal tissues strong and healthy. We're never going to build the terrain to be able to withstand the onslaught of the bacteria that we get from any just normal things that are going on, or that we carry with us from our childhood, from the time we're small children, and we receive that infection from our parents or caregivers, and then throughout life as we share food and kisses and whatever with others. So this is Gino, and Gino came to me because he really felt like his dental situation was keeping him from getting dates. So here's his profile, and he was, I believe, 40 years old. This is what he looked like, and I know you hygienists get a kick out of these kind of patients, as I do as well. And here he is. So we did have to remove some of those teeth, the mandibular anteriors, and a few others. But here are his blood results pre-op and post-op, and I just want to show you that this is just 90 days later. But look at the change we made in his blood pressure. from 160/80 to 140/70. His cholesterol level from 323 down to 221. His triglycerides from an alarming, absolutely crazy, unbelievable level of 2,069 should not be over 149, but we got him down to a 439 within 90 days just with our periodontal protocol alone.
That's astounding.
Just with our periodontal protocol alone. And we did supplement him with vitamin D3 because he was shown to be so deficient. He is in a terribly deficient state of 17 nanograms per ml, and we have had patients down to a 4, multiple patients who are as low as a 4. The physicians will accept a 30 or 32 as being okay. We want, in my protocol, I don't accept anything less than a 60 to 80 nanogram per ml level for wanting for my patients. So anyway, this is, you know, so we decided at the end to we put that Amoxi and Metro was a combination of what our DNA results showed he needed, and the doxycycline we put him on because he was continuing to smoke. And that would be the only time I would consider that, is if a patient has a severe level of periodontal disease and is a smoker and not able to stop at that time. So even with him still smoking, this is what we got, and I think that's pretty
Lisa
impressive.
Marie,
yes.
I do too, and just stop me if you're going to get to this anyway. But when you do prescribe this and this treatment, and the patient complies for 90 days and they see these results, are they inclined to continue the treatment, or do they have the mindset that
absolutely, yeah, and
okay.
we'll yeah, and I mean it's hands down they're committed. They are certainly committed, and they see the result. They feel the results. I mean, within the first week of being on the nutrients, they are a different person. They feel transformed even before we start their treatment. So they already have.
And I think the reason that you might see that, well, and they've been partners in their care. I mean, much of this is happening at home.
I don't ever
unlike
want to
going in and having
to a patient. Yeah.
Right. I mean, that's the difference.
You know,
they go in and they get a procedure done, and then they think they're good, and then 2 years later, like you said earlier, they're back, and they blame you.
We have a tremendous long-term stability in our patients. In fact, I had a dental hygiene consultant come and she spent 2 weeks with me in my practice, and every single periodontal maintenance patient that came in, we filled the schedule with PMTs and hygiene patients, most of whom were originally PMT patients or perio patients of some sort, gingivitis. The majority of our patients were PMTs, and for all of those days from stem to stern, we filled all 4 columns of our schedule with these patients, and I'm going to tell you, not once did she see a recurrence, not even maybe a few bleeding points in one patient or another, 2 or 3, but it was remarkable for me because I had no idea who the patients were going to be. They were just due at that time, and my scheduler put them on the schedule, or they were on the schedule already before this consultant was even coming. So it was really quite lovely to see that. And anyhow, so Gino was a manager of Cheeseburger in Paradise. So when we saw those 2,039, you know, triglycerides, they were in fact so true that I actually had the lab run the test a second time because I didn't believe them. And in fact, it was accurate. And this was his DNA test. You see everything over the horizontal line means we need to treat those bacteria because those are at levels 10 to the 6th power. Those are levels that the human body cannot manage according to the research. So that's the day we met him. There's him 3 weeks later with some wrought wire partials in. I mean, that's all we did right then. So anyhow, but let's get into testing because this is also a really important part. And I'm going to go really fast because I know we're really pushing for time here. But I felt like the nutritional piece, and Danny, I know you did too, was such an important part that we needed to spend that time to really give you a pretty good idea. But we go into so much more depth in the course. So anyhow, DNA testing. So phase contrast microscopy, whether you have a microscope or not, is not it is not necessary to have one. It just makes it a little bit easier to capture your patient's attention immediately. So when we see our patients on consultation, we do a quick screening in the clinical area, or we invite them to come back for that, and 100% of them say yes. And so while we're in the chair, we take a microscopic slide. We ask their permission to just touch under their gums for a second, just real gently, to take a look at the bacteria that's present in their mouth. And so, you know, it's not uncomfortable, and we just insert the probe where we think it might be deep or where it looks. Usually I go the buccal of the maxillary posteriors, or the lingual of the mandibular posteriors, or the lingual of the mandibular anteriors, and we take little specimens, put them on the slide. It takes about 5 minutes to do. The slide costs about $5, and we put it up on the screen. So, you know, again, in 2006, the American Academy of Periodontology had published research in our journal that said that they believed microbiological testing should be an important tool in the treatment of periodontal infections, and that was in 2006, right as DNA testing was coming to this country. But this testing on a phase contrast microscope was established very long ago with Dr. Paul Kai's, some of you might remember, in as early as 1982 maybe. And these slides are courtesy of Bill Landers, and I do want to give him credit for his beautiful microscopes and and sharing of his knowledge with us, and happy to give you that research. But these are the things we see, and those spirochetes that you saw in that last slide are just deadly, literally. Well, so many of these are deadly. It's not uncommon for me at new patient examination, or at least at treatment presentation, to share with a patient that they have a life-threatening level of periodontal disease or dental infection, and to share with them my concern. And usually that does occur either in consultation or as we see them and review their slide with them, or during their new patient exam, and that's typically when it's more appropriate to have it, just depending on your patient. And so this is Alice. These are red blood cells and lots of bacteria and so forth scattered around, and so we see and some white blood cells. So we just see that there was a high level of infection going on when we saw her, and that's tissue on the bottom screen and some things. But basically, we've got a pretty clear screen just a month later, and we haven't even finished her treatment. The treatment typically lasts between 2 and 3 months, seeing them about every 10 days, and that's our entire protocol for non-surgical treatment, and that's how we get these results. And here's Charlie with just a tremendous number of white blood cells, just highly infected. And here's Brandon, age 28, and his mouth just a bloody mess. And here's Tom, age 75. But just looking at the June and then into August, what we got, and you know, so here we are, and here's Hickson at the age of 12, and he literally, when we did his DNA test, we found spirochetes. Oh my Lord! And there are spirochetes on these slides. They're just not large enough for you to see, but they are in there, and I think we've got several of them. Not a huge abundance, but lots of rods and things that shouldn't be there. So here's sample taken pre-laser treatment on a baseline slide, and then down below, right after, immediately after, we used the CO2 laser. So, and the same thing we would see if we used ozone. So I do not teach an ozone course. I teach how we implement ozone within the practice of our protocol, of dentistry in general. I give a few, you know, a little section on that just to kind of flesh out the ozone attributes, because they are so robust. But there are some wonderful courses being taught out there, and places where I learned myself from Bill Dome, and there are people like oh my goodness, there's just a whole
Julian
host.
Holmes.
Tim Rainey, yeah, and Tim Rainey and Julian
Right.
Holmes, thank you. And so anyhow, but easily accessed. So anyhow, and now we'll get into blood testing. So the way we get into, so we've married well, actually, we're getting into the DNA testing. I'm sorry there. But we go from the microscope directly into selling our patient, you might say, onto the idea of DNA testing. So right then and there during that new patient exam, when we're showing them the microscopic slide and they're freaking out because these bugs are crawling around in their mouth, and this is gingivitis on through. I mean, you know, all the way through. We've actually found a child 2 years old I did a slide on because her little sister, who was 7, was showing signs of gingivitis, and I'd been seeing them every 6 months, and mom also, and mom was perfectly clean and clear, but the 2 children had it, or the 7-year-old had gingivitis. So I did a slide on her, and I find bacteria that shouldn't be there. So then I do a slide on the 2-year-old just for the heck of it, and the 2-year-old has spirochetes. They both had spirochetes. So I say to Mom, tell me about Dad. I know we haven't had a chance to see him yet. And I've seen them for several years, but we just couldn't get her to get him in. And she said, my husband has never seen a dentist since he was a little child. He's in his 30s. And she said, but this is, I don't know that I'll get him in. And I said, well, your children are suffering, so please make sure that, you know, these spirochetes will be with these children till the day they die unless we find a cure for spores, for spirochetes. So this is, and I'll get into that in a minute, but there is no known, so to speak, cure for spirochetes because they go hidden into a spore form, and they just keep sort of, as I say to patients, they kind of rehatch. They go through their life cycle and come back again. So we find spirochetes in the gum tissue of edentulous patients. So, you know, they're there forever, and just like in Lyme disease and syphilis, leprosy, and Alzheimer's disease, all considered spirochetal diseases along with periodontal disease. So anyhow, we get into the phase contrast, or using the DNA testing. This patient came in for whitening. I don't think so. This is my Q-tip touching, and this is actually at the end by the time my assistant got the camera. And this is the tail end of the pus that came out, but it just absolutely poured out. So you can see the AA bacteria. We all remember that lovely long term that we learned in first year of dental school, and we're so proud that we could pronounce. So the AA is exceedingly high. It's a high-risk pathogen for periodontal disease, and T. denticola, the TD that you see there in the left of the screen, is also over the limit of any ability for the human body to handle. So T. denticola is the spirochete that we are very, very worried about. And but we also can test for genetic susceptibility, and perhaps that's even more critical than the bugs that are infecting us. And oral DNA labs through Access Genetics. Oral DNA is that's the company that I first started with in 2006, I believe it was, and then began teaching that in my seminars in 2007. I began teaching the use of DNA testing when they were the ones that they were the ones, the only ones that we had in Tom Neighbors. We have to thank for bringing this to our you know, our profession from Germany. So anyhow, and this is a beautiful photograph that, or picture that you've seen before, but this came from Oral DNA Labs, and I sometimes share that with patients. And this one also has a comparative paper that comes out when you do their post-test. And so we see the high level, we go through treatment, we post-test them always at the end of treatment. When we feel they are stable, we do their post-test, and we see that these have all gone down. OraVital has just come out with a brand new DNA testing that includes strep mutans and candida. So this is something that I'm looking at very seriously right now, and I'm very excited to be able to share with you all tonight. I just popped those slides in there when I got them today. So genetics, all family members of patients with periodontal disease, whether there's a genetic predisposition or not, every member of a family with periodontal disease should be evaluated for periodontal disease, because the family becomes what I consider and share with my patients a pod of infection. So remember all the organ systems that we looked at before, and the top 4 that I can identify, the top 4 bacteria would be P. gingivalis, T. denticolon, F. nucleatum, and AA. I really can pronounce it, but for the sake of time, we're just going to move forward. And this is what P. gingivalis affects, all these organ systems. So you can kind of see how you could take their DNA test, and where it shows that they're high in P. gingivalis, they actually you can take this chart, and your assistant can show this to the patient along with their DNA test, just showing them actually the organ systems that are being affected so dramatically. So we do know that if P. gingivalis is present, we have a hot target, and there is a tremendous decrease in vascular wall stability, increasing the risk of cardiovascular event. So we're also see, of course, it's present in 72% or 42% of the carotid artery atheromas. This is research from Dr. Bob Janko, who's considered one of the grandfather of oral systemics. I believe he actually coined the term oral systemic link many years ago in the 90s. So anyhow, it's believed that as many as half of all heart attacks are triggered by oral bacteria, and that every thrombus and 30% had live oral pathogens in the clots. So anyhow, 50% increased risk in COPD with patients with periodontal disease and P. gingivalis. Brain abscesses and oral infection, it actually is the most probable source of multiple brain abscesses. And in fact, physicians have been told that if they have no known reason for brain abscesses, they need to be looking at oral infection. What a shame that it's after the fact and not before the fact. And T. denticola, the main thing here is just massive tissue destruction, and we spoke about T. denticola as a spirochete, and these being the 5' spirochetal diseases that we know of. Dementia, we see quadrupling the odds of dementia, and if periodontal disease is found before the age of 35. Healthy brain, advanced Alzheimer's, periodontal disease and/or lost teeth can quadruple the risk of Alzheimer's. Now, one of the most astonishing things and disturbing things is that T. denticola has been found in the brain of edentulous newborns and young children. How does that happen? So, F. nucleatum, along with T. denticola, deadly, literally devastating effects on pregnancy and the passage through the placenta. With F. nucleatum, we have seen it also in colorectal cancer and the preterm birth of babies, stillborn babies, preeclampsia in the pregnant woman. And Dr. Yiping Han out of Case Western actually published this documented case that she was brought in on and determined the cause of death of a full-term stillborn baby to be from septicemia caused by F. nucleatum, which had passed through the placenta, from the mother through the placenta, and was found in the baby's lungs and stomach. What a devastating consequence, and something that we have complete control over preventing in our patients if we are able to inspire them, to motivate them to receive the care that we are able to provide for them. So anyway, yeah, and 50% of preterm babies have no known cause. We do not know why they had that, and look at all the devastating effects of preterm dangerous frequency. And all of these cancers are linked to periodontal disease, or periodontal disease is linked to all of these cancers. And I'm sure many more that the research is going to show. So these are DNA tests that we're going to breeze through real fast, and we're getting very close to the end. So thank you for staying with me. So here's Patricia and her husband. You can see how these bacteria have been passed back and forth. Patricia did not have clinical evidence of periodontal disease, yet she was on the brink, as I tell my patients, on the fence. Not clinical signs, but she had a hefty terrain. Her tissue was beautiful. She ate well, still eats well many years after this. She's a healthy woman who exercises and looks like she's about 50 years old. Her husband, on the other hand, is obese and became edentulous shortly after this. So you can see the difference. He succumbed to it at a very severe rate of periodontal disease, and she did not, even though their results were very similar. Here's Deborah, and here she was pre-op, here she is post-op after our treatment. Very successful. We have hundreds of cases like this. Cheryl, mom, and Cameron, son, very, very similar, spooky similar in what they've got. Cameron and every male in his family for 5 generations had lost all of their teeth by the time they were in their 20s. And Cameron came to me and had several teeth remaining that were severely periodontally involved, so he was going to be another one. So we don't know what happened in that family, but they don't live locally, and as much as I've tried, we have not been able to. I wanted to provide DNA testing for them for free and do all kinds of other research with the family, but they live in another state, and I wasn't able to pursue that. But here's Cheryl, the mom, and you can see how successfully we treated her. We got rid of all of her AA and got all of those moderate risk pathogens down and low risk. Here's dad, mom, and daughter. Dad had diabetes, mom not. Mom was very clinically healthy. Daughter, yet dad and mom, we assume, shared saliva, shared kisses, whatever, shared food, but mom, dad, and daughter. So look at dad and daughter. Guess what? Daughter is a pharmacist. Guess what? Daughter is a very young pharmacist, born in 1981, and this was several years ago, and she had diabetes along with dad. So look at that. And we know diabetes is bidirectional disease. So meaning that periodontal disease causes diabetes to be worse and can actually cause a pre-diabetic to become diabetic, and vice versa. Periodontal disease, diabetes will cause a patient to become periodontally debilitated. So anyhow, here's Larry before and after, so you can see we did a pretty good job with him. And the moderate risk pathogens, am I going to put him on any systemic antibiotics again? No. And I am just going to work with him more on his lifestyle and nutrition. And I will maintain him on targeted nutritional support probably for years to come, if not to the end of his life, because he's a diabetic, and I don't want, and everything, all these nutrients, of course, if they support the oral tissues, they are definitely going to support the rest of the body robustly, because the oral tissues, anything that supports the oral tissues has got the rest of the tissues healthy. So if they look healthy, the rest of the body internally is probably at a very, very high level of support, because the oral tissues, the soft tissue, turns over 7 times faster than any other tissue in the human body. So for that reason alone, it requires more nourishment. So here's Jessica pre-op and post-op. Pre-op on the right, post-op on the left. So there she is with her post-op results. So we were very, very pleased with that. And again, she was young at the time. And blood testing, let's just spend 10 minutes on this, and I think we can wrap it up. So if not, if shorter, if I need to be, Danny. So blood test screening, Dr. Michael Glick years ago wrote in JADA and actually in, I think that was Newsweek magazine, that dental professionals should be doing this. We should be testing. And these are the tests that I focus on, the ones in the fuchsia. The bottom ones I want, and usually the physicians have already got that on their patients. But the A1C and fasting blood glucose, we're looking at diabetic markers. Then with the HSCRP, that's a high sensitivity CRP versus a general CRP. With that one, we're looking at inflammation and future risk of heart attack or stroke. Vitamin D3, we're looking for deficiencies in D3. The plaque 2 is we're looking for issues of cardiovascular health as well. So again, we go back to that position paper, biochemical assessment. And so we're looking, we can get the blood testing going with this, and Dr. Michael Glick's contributions for recommending blood work. So anyhow, these are, and 69 to 86%, and probably everybody on this call would be willing to do some chairside screening for these things. So it's not like we don't want to, it's just that we don't know how to, or we haven't established protocol within our profession, at least not a standard of care. And in 2007, when I launched the Institute, I said, come learn what I consider the what is going to become the standard, we cannot do that, the literature shows. So the A1C measures average blood sugar over 2 to 3 months. Remember the risk factors that we looked at? P. gingivalis and periodontal disease. When we're talking about diabetes, we're talking about those little microscopic bottle brushes that I talked about earlier. And I like to use this visual. It's like taking those microscopic bottle brushes and pouring syrup in the blood vessels, and the blood becomes like syrup because it is so filled with sugar, and we're also scrubbing the insides raw. So these are very powerful visuals, and I'm an artist. I'm a professional artist, and so I am a visual learner, and I'm a visual communicator, if you haven't been able to tell already, and I hope it's helping you to get excited about this. And I just share with you Layla. She came to me, she said, my mouth feels a little swollen over here. I take a look. Oh my gosh, she's got a whopping periodontal endo abscess. We just have to remove this thing. Her blood sugar was 300. Broke my heart, because I know this woman had had regular dental care her entire life at a very high level, and she also lived a very healthy life, even though she was diabetic, but her diabetes went out of control. She was under a tremendous amount of stress. Her diabetes went under control, and she was also being seen every 3 months because she was a diabetic. And guess what? She is my mother. She is my mother, and she was treated by my periodontist father. She had a level of hygiene, meticulous, everything, beautiful, her hygiene and her health for years. And she became my patient when I went to dental school, and has remained my patient ever since. So you talk about a kind of come to Jesus moment for me and my mom when this happened, because I was devastated, as you also would be. And here's Michael the day of surgery, and look at his mouth. And this man never stopped smiling. Here he was 52 years old and was disabled from work. He had a diabetic crisis and had one foot amputated and part of another, bilateral hip replacements, and was preparing for the third hip replacement. Do we really think they're going to last with his mouth like that? Arthritic knees, high blood pressure, lupus, pain in his mouth and body all the time. But yet he was a joyful man, and he did not come to me on his own. It was his sister who brought him to me. And that's the day we met him. There he is a week later when we dentulated him and put in some immediate dentures that day. And so precisely from that. It's not from him having an opportunity to heal from his disease to any great deal.
Lisa Marie,
respect. Yes,
we have 3 minutes remaining.
Okay. So anyhow, let's just kind of slide through here, and we are going to. I want to get to. We've actually covered most of this, and we've covered this. I guess I got ahead of myself and didn't even realize it. So let me, would you all mind if I take my screen down for a moment so that...
I just think we should get to the
I need to
so that we can share the offer.
That's what I want to do. So let me slide down a few slides so we can get to that. And I'll share, where are we? Total body wellness at its core, supporting that beautiful world-class aesthetic cosmetic care that you all I know must provide. So imagine that our patients will be transformed this quickly through the care that we can provide for them. And as Dr. Chip Whitney says, who's also, I believe, a founding member of the American Academy for Oral Systemic Health, doctors and teams don't ever underestimate the critical role that dental professionals play in the overall health of your patients, even in saving their lives. So we're not out on a limb, we're not out in left field. We are really in the business of transforming the manner by which we help people heal and caring for each human being through the lens of total body wellness. So I invite you to come and join us for our unique brand of experiential learning and learn how we do this in a little bit more in a lot more detail, 2 days of detail as opposed to 70 minutes. So here we are at my beautiful office in Newport News, Virginia, a beautiful, beautiful area of actually on the East Coast and Chesapeake Bay and Virginia Beach, all kinds of wonderful things, plus some incredibly amazing historic sites nearby. So plan to spend a few extra days if you can, because this is our garden week here in our area, and it's absolutely gorgeous.
Don't forget to share what
Oh, you mean in addition to all the, in addition to what I just said about how beautiful it is? Okay, $500 off of the tuition for your team to come, and we already have a tremendous special rate that we are offering for this one last time. And we offered this last year once, and we're offering it one more time. I really love showing off my office and having people here and being able to be hospitable and kind and caring with my colleagues as well. So give Annette a call.
Definitely.
Yep.
And that is
log on
your
to our
seminar
website.
Coordinator.
Yes, she is, and she's been with me for many years, about 28 years, and is now doing the seminar coordination exclusively. So she is, and PerioPassionDentalSeminars.com, if you'll go to the website, you'll be able to see a few little video clips from me and lots of testimonials from doctors from all over the world who have come and taken the taken the course. And so we've impacted people in 7 different countries. We've been able to teach. So I
definitely time well spent. And Lisa Marie, thank you very much for sharing this taste with us. Time went fast, faster than we in fact had hoped. And we promised to respond offline to each of your questions. So at this point, I just want to thank you again for a really a scintillating and inspiring presentation. I'm sure it's clear to everybody why you've been invited to headline this year's AI Scientific Session in Orlando. And in a few days, everyone, you will receive an email with instructions on how to receive your 1.5 hours of CE credit. And I now want to invite all of you to mark your calendars for our next webcast, which will be on Thursday, March 31st at 6:30 p.m. Central Time, when my very special guest friend and another founding AASH member, Dr. Piero, who, for obvious reasons, goes by Dr. Piero, will deliver his provocative presentation entitled, "Brushing Your Teeth May Be Hazardous to Your Health." Until then, this is Dan Barbaro with special thanks again to you, Lisa Marie, and to all of you for your continued commitment to practice perfection. Goodbye.
Thank you so much. Thank you, Danny. It was such a pleasure. Thanks,
You're
everyone.
welcome.